Welcome to the A&D Medical's live Q&A. My name is Abraham. I am an advanced medical practitioner and pharmacist, and I am the host and lead of the YouTube channel at A&D Medical, where we create content all about cardiovascular health and well-being. So every first Thursday of the month, I appreciate it's Friday today. We had a bit of a technical issue, so it got delayed by a day. But every first Thursday of the month at 8 AM PST, we go live on the channel answering all your questions, answering all your comments. So my best advice before we begin is please leave your questions in our comments on our videos, or whilst I'm on the live as well, I will try my best to get back to every single question and comment that we get. But in case we don't have enough time, we will always get back to you in next month's episode. So definitely stay in tune with us, definitely keep up with the comments, and without further ado, let's begin. So we've had a comment before a few weeks ago, and I thought it was a really interesting one. It was, what do my numbers mean? What is a good blood pressure and when is it too high? This is extremely appropriate because right now we're in May. And for those of you who might know, May is known as May Measurement Month. Measurement Month. I can't speak this morning, but it's perfect timing. So let's go into some more detail on it. So when we look at blood pressure, there's always two numbers. All right. So I've got my blood pressure monitor here. So as you can see, there's two numbers here. We have the systolic. So for this example, hopefully you can see it's 105. That's when your heart beats, okay? That's when it contracts. So our blood pressure is much higher on our systolic. And then our diastolic is when our heart basically relaxes and blood flows back in. And that's 68, all right? So it's always a lower number. Both systolic and diastolic are very important numbers. However, after the age of 50, systolic matters a little bit more, and that's due to aging of the arteries, all right? But we go through that in a lot more detail in our videos, but I just thought it's a good tip. We always like to give nice tips whilst we're doing the live Q&A. By the way, if anyone does leave a comment whilst we're doing the live, I will get back to you, so don't worry, okay? So that's what blood pressure is. Now, when we're looking at blood pressure, we're going to start with normal blood pressure, all right? So a normal blood pressure is anything below 120 over 80 millimeters of mercury. That's a perfect blood pressure. That's very healthy, and it probably is an indicator that you're living a very healthy lifestyle and you're doing everything right, okay? So 120 over 80 or anything below that is perfect. It's spot on. So that's a normal blood pressure. I'm just going to basically work my way through like different blood pressures now for you all. So the next blood pressure we have is what we call elevated blood pressure. So this is anything, if it was systolic, so I'm just going to show you on here again, just because it makes it easier to show. So anything that's got a systolic between, so this number here, 120 to 129, and a diastolic of under 80. So this example, the blood pressure is perfect, by the way. But if your systolic is between 120 to 129 and your diastolic is below 80, this is what we call elevated blood pressure. So it's not something to be massively concerned about, but it's something for you to be aware of and watch your blood pressure, okay? So it's a good idea to try and cut back on salt. It's a good idea to do more exercise. If you are slightly overweight, trying to lose weight. We go through loads of details on the channel, by the way, on natural ways to lower your blood pressure. So it's a good idea to watch those videos and try and incorporate some lifestyle changes as well. And obviously as well, it depends on you as an individual as well, as there might be various different factors as well that blood pressure might be really good for you, and your medical provider might have told you that's actually fine for you. So elevated blood pressure, it's good, but obviously it's just a few things that you might be able to do to bring it lower. I think with elevated blood pressure, it's always a good idea to keep track of your blood pressure a bit more. So if you've got normal blood pressure, so like we said before, below 120 over 80, checking your blood pressure once every month, every couple of months is perfect, okay, just to make sure that it continues good. Or if you've got elevated blood pressure, I would check my blood pressure, maybe once every week, once every 2 weeks, something like that, just to keep an eye on it and to see if it's actually starting to creep up at all, because blood pressure is a silent killer. We've spoken about this a lot on our channel. You don't realize it's going up, but then when it starts to go up and it goes to more dangerous levels, it increases your risk of cardiovascular disease and various different health conditions, okay? So it's always good to keep an eye on it. One tip as well that I always like to say to patients is make sure you're using the right cuff size, okay? So we talk about this in our recent video actually on blood pressure cuffs and measuring them. This is an A&D Medical blood pressure cuff. So most of our monitors come with a wide range blood pressure cuff. So that means that this cuff fits an arm circumference. So my arm circumference is here of 22 to 42 centimeters, and that's 8.6 to 16.5 inch. So one mistake I commonly see many patients making is using a blood pressure cuff that's too small for them, okay? So if my arm circumference was bigger than 42 centimeters or 16.5 inch basically, then this blood pressure monitor is going to give me an overestimated blood pressure reading. So it's not going to give me an accurate reading. And the same applies, by the way. Well, if I have an arm that's below the circumference that this blood pressure cuff fits, okay? If I have a smaller arm circumference, so below 22 centimeters or below 8.6 inch, then it's going to underestimate my blood pressure, okay? So this is just something really important to remember when it comes to blood pressure monitors. We go through this in a lot of detail on our video about blood pressure cuffs that's just come out. So definitely do watch that if it's something that interests you. So that's elevated blood pressure. So we spoke about normal blood pressure and elevated blood pressure. The next blood pressure we're going to talk about is what we call hypertension now, all right? So hypertension is the medical term for high blood pressure. It's when we get diagnosed with high blood pressure, all right? And we have different stages of high blood pressure. So we have high blood pressure at stage 1, and that's a systolic. Again, I'll just bring out this for an example. So that's a systolic, so that number here, of 130 to 39, and a diastolic of 80 to 89. So what can you do for that? Well, you can definitely do lifestyle changes if it applies to you. So all the lifestyle changes we spoke about before, definitely do watch the video. This really then depends on your medical provider, whether they start treatment or not. Some patients, they might start treatment, some they might not because of different factors. So it really is individualized. But one thing that's really important is regular monitoring, all right? And if you've got a blood pressure that's in stage 1, it's good to check your blood pressure, and if you've got it under control, you can check it, once a week, twice a week, all right? But if it's not under control, you're going to do much more regular monitoring, and your medical provider will tell you that. They might ask you to do 7 days of home blood pressure readings and bring them into the clinic again. So keep a track on them. One thing that I always advise in all of our videos as well, I'm just going to show you on my phone, is the A&D Heart Track app. If you don't have this already, download it today. So I absolutely love the A&D Heart Track app because you can basically monitor all your readings on here. If you have one of our A&D Medical blood pressure monitors that's Bluetooth enabled, for example, this is the A&D Medical Precision Check Pro device. Back there is our Precision Check device. These are Bluetooth enabled, and you can pair them up with the app. So all your readings will just go straight onto here, and you can see them in graph form. It will average them for you. You can see trends. It is fantastic for monitoring your blood pressure compared to the old way of just writing it on a piece of paper. It's free, so go and download it. I 100% recommend it. Just search A&D Heart Track on either Google Play or Apple App Store and just download it and continue monitoring your blood pressure readings. And it can be really useful for patients, but not just for patients, for medical providers too. When we see something like that, we love it because it makes our life easier and we can monitor your health better as well. So that was stage 1, high blood pressure. We're going to move on to stage 2. Stage 2, again, I'm just going to pull out my A&D Medical blood pressure monitor. So stage 2 is a systolic of more than 140 and a diastolic of more than 90. If you've got blood pressure this high, medication is probably quite likely, but again, it depends on your medical provider. Lifestyle changes should 100% continue, as we discussed in our other videos, and I've discussed a little in today's Q&A. And regular checkups is critical, all right? So you need to be checking your blood pressure quite often. If your blood pressure is under control with treatment, checking it once or twice a week is good. It's a good idea. Checking it more often than that is also a good idea. But if your blood pressure is not under control, you need to be checking it way more often than that. Again, your medical provider might ask for 7-day home blood pressure readings to average them and to bring them into clinic, and they can continue reviewing them. One thing that I really love about, so this is the A&D Medical Precision Check Pro device. That back there is the A&D Medical Precision Check device. And a lot of our other A&D Medical blood pressure monitors actually have something called Tri-Check technology. And it's our trademark technology at A&D, where basically you can set the intervals for your blood pressure monitor to take 3 readings, either at 30 seconds apart, so each blood pressure reading, or 60 seconds or 120 seconds. So you'll basically click start once you've done all your things to do your blood pressure correct, and then it will take a reading, and then it will wait for either 30 seconds, 60 seconds, or 120 seconds, whichever you set. I like it at 60 seconds, and it'll take another one, and then it'll wait 60 seconds again, and then it'll take another one, and then it will average those readings. So it makes your life so much easier, and you're taking your blood pressure correctly. So I can't recommend the A&D Medical Tri-Check technology enough. If you have an A&D Medical device, that supports the try check, please turn it on. So the last thing I want to discuss about blood pressure readings is what we call a hypertension crisis. This is important to be aware of. So this is if your blood pressure, I'll just show you on here again. So your systolic is above 180 or your diastolic is above 180. This is an emergency and it shouldn't be taken lightly. If you've taken a reading and it's either your systolic's over 180 or your diastolic's over 120, sit down, relax for 5 minutes, take your blood pressure again. If it continues to be above 180 over 120, then you need to seek urgent medical advice and call for emergency services, because that is an emergency crisis. You are at very high risk of a cardiovascular event, like a stroke, like a heart attack, and also you're also at higher risk of kidney damage and permanent eye damage as well. So these are some of the things that could potentially happen. So that's why it's called a hypertensive crisis. So I think that's a nice little summary of, what blood pressure readings are, what's good, and what's, something to be concerned about, and then going through the different stages. Let's just check the comments. We've got a comment from Megan. Thank you for being excited. We talk about high blood pressure a lot. Is low blood pressure ever an issue? Yes, low blood pressure can be an issue. Low blood pressure, it really depends on medical conditions as low blood pressure. Certain medical conditions, we don't want a blood pressure that's too low, all right? The best way to describe it is 120 over 80 blood pressure is the gold standard. You can go lower than that as well, even up to 110, 105 on the systolic. Going any lower than that, it's not potentially going to cause any problems, but if you have some medical conditions, we don't want it to go too low. So the best advice I can give is, if you are ever feeling like your blood pressure is below 120 over 80 and you're feeling lightheaded, and like when you're standing up, you're feeling dizzy, you're feeling lightheaded, or you've even had some falls because of dizziness or lightheadedness, or especially when you're standing up and moving quickly, we call this postural hypertension. If you ever get anything like that, you need to speak to your medical provider and make them aware of it. So that's the best advice I can give for that. And I'm loving it. I can see the comments in this episode, so I'm really happy. We've got a message from Hedia Husseini. How often am I supposed to take my blood pressure? I'm 32 years, by the way. Okay, let me get back to you on that one, because that's a really good question. Actually, we'll do that now. So I think we've touched that a little bit whilst we're talking about the blood pressure readings. So I'm going to summarize this, how often you should take it. So if you've got normal blood pressure, so below 120 over 80 that we spoke about, you can take your blood pressure, once every month, once every couple of weeks if you want. That's completely fine. It's just a good idea to keep an eye on your blood pressure to make sure it's not going up. You mentioned that you're 32 years old, so I doubt you're going to be at high risk of it going higher very soon, because you're very young, but it's a good idea to keep an eye on it. If you've got an elevated blood pressure that we spoke about earlier, so that's 120 to 129 on the systolic and less than 80 on the diastolic, that's like it's creeping up a little bit, and you've got to keep an eye on it. Again, you don't need to do it extreme, taking blood pressure every single day, but I would take it once a week, twice a week, just to keep an eye on it, make sure it's not creeping up. Because if it's creeping up above that, then we're talking hypertension diagnosis, and we're talking high blood pressure diagnosis. And then when it comes to high blood pressure stage 1 and stage 2, again, it depends how under control your blood pressure is. If your blood pressure is under control, I would recommend checking it once or twice a week, just to make sure the medication you're taking is working and everything's in check. But if it's not under control, like I said earlier, your medical provider might ask for 7-day home blood pressure readings, and they might ask you to do 3 in the morning and average them, like we talked about with the TriCheck technology, and then 3 in the evening, average them. Do that for 7 days. So it really depends on what your medical provider advises, but the 7-day home blood pressure readings is the gold standard. And of course, with hypertensive crisis as well, that's a different kettle of fish entirely. So if you've got a blood pressure of 180 plus or over 120 plus, then you need to seek urgent medical advice, especially after rechecking after 5 minutes. So I hope that was helpful. Let's have a look at the continued comments. I'm just going to go to another one of our comments before I go back to the live, because I'm loving this engagement that we're getting today. So that's awesome. But this was a comment that we got a couple of weeks ago, and it was from one of our shorts. It's had thousands of views, and it was one about temperature and blood pressure. And I think this is a really important factor, because not many patients are talking about temperature. They don't really know about temperature and its effects on blood pressure. And unfortunately, not a lot of medical providers are aware of the effects of temperature and blood pressure. It's something that we're learning more about. But the comment was that humans are warm-blooded beings. Our blood pressure has minimal influence by outer temperature factor unless you're in the Arctic or Saharan conditions. So thank you for your comment. I'm going to state a study that was published actually by the Journal of Hypertension, and they found that indoor temperature affects blood pressure quite considerably. So just to give some facts, they did a study on 4,659 participants, and they found that for every 1 degree Celsius, that's about 2 Fahrenheit on average, because 1 Celsius to Fahrenheit conversion is very difficult. But for every 1 degree Celsius, about 2 Fahrenheit drop in room temperature, participants' systolic blood pressure dropped by about 0.48 millimeters of mercury, and the diastolic dropped by about 0.45 millimeters of mercury. So you don't need to have, Arctic conditions or Saharan conditions to make a big difference on your blood pressure. Let's say if your home is 21 degrees Celsius, so 21 degrees Celsius is about 70 Fahrenheit. That's what I like to keep my home at, that temperature. But if your room temperature drops to 15 degrees Celsius, so that's a 6-degree drop, you've got a potential difference in blood pressure of about 3 millimeters of mercury. So it can be quite a considerable change. The reason for this basically is in cold temperatures, we get something called vasoconstriction. So our blood vessels narrow, and this is to conserve heat, because if our ambient room temperature is cold, we're going to get vasoconstrictions. We're trying to conserve heat to stay warm. Now, the best way to think of this is think of a hose pipe. If it's water flowing through it and you put your finger at the end of it, the pressure increases. So that's kind of like vasoconstriction because we're constricting. So then our blood pressure goes up. The opposite happens if our room temperature, our ambient room temperature is warm, all right? So if you have a very warm room temperature, we get vasodilation. That's basically to help cool our body down. So again, think of the hose pipe, but instead of constricting it, you let go and you see that the pressure drops all of a sudden, or you've got a much wider hose pipe and you're going to see the pressure is going to be far less. So as a result, we get lower blood pressure readings when the ambient room temperature is warm, and we get higher blood pressure readings when the ambient room temperature is cold. So again, it's an important factor. Thankfully, our A&D Medical Precision Check Pro device, the one in my hand, this is our newer range, by the way, the Precision Check devices. They're absolutely phenomenal. The Precision Check Pro device, it actually records the ambient room temperature with every reading. And I absolutely love that, because with every reading that you've done, if let's say you're getting a reading that's a bit of an outlier, and you might be able to see some correlation there with the temperature, because, for example, you might have forgot to put the heating on, or your heater's not working, or the room's really cold all of a sudden, you might be able to see some correlation between ambient room temperature and your blood pressure. So I can't recommend it enough. I think it's fantastic. And yeah, so that's just in response to that comment. So I'm just going to go back to our live questions. Okay, we've got a comment from D. Henderson. What does consistently low diastolic blood pressure under 65 mean? What can I do about it? This one's a bit more of a tricky one, because there are different reasons and causes for this as well, especially as we get older. If you're having a consistently low diastolic blood pressure, I would advise speaking to your medical provider about it, because there can be many different causes for this. Sometimes certain treatments can actually cause the diastolic to drop. Sometimes certain medical conditions can cause that as well. And then we've got sustained systolic, but then a dropped diastolic. So my best advice for that is speak to your medical provider. On the A&D Medical channel, we can't really give medical advice in terms of what to do. So unfortunately, I can't go into too much detail on that, but it's a good idea to speak to your medical provider on that. We've got a comment from AJ. What are some immediate practices someone should do to fight hypertension? Well, that's a great question. We have videos on the channel, by the way. So I firstly highly recommend everyone to watch them, because we go into a lot of detail on different natural ways to lower blood pressure, as well as taking your blood pressure correctly with the monitor, because there's so many mistakes that patients and even medical providers make when they're taking their blood pressure readings. So it's a really good idea just to recap it. And I know you've probably been taking blood pressure for years, and everyone, in their own mind thinks they're a pro, including myself, by the way, and there's always new things that you can learn. So it's always a good idea to recap and watch. And you might notice that, oh, actually, I am making that mistake. Oh, I am actually shaking my leg when I'm taking my blood pressure. Oh, I am actually, not having my arm fully supported when I'm taking my blood pressure. All these different factors. But in terms of what you can do immediately, the first thing I'd recommend is lowering the amount of salt that you eat. So try and have a lot more home cooked meals. In terms of how much salt you should have. So if I had 1 teaspoon, basically, you shouldn't have more than a teaspoon of salt every single day. So try and cook your own foods. Avoid ready meals. Avoid eating out as much, because you can't really tell how much salt there is in these. Also, ready meals are notoriously high in salt. So reducing our salt intake is probably the number one thing. The next thing I'd recommend is exercise. So doing exercise every single day, going for a 20-30 minute walk. It doesn't have to be anything intense or really hard or difficult to do. Just going for a walk every day is going to help with lowering blood pressure. It's going to help with getting more exercise in, and just being more active is going to help. And then we can slowly try and increase our speed of walking, and also increase the things that we do for exercise. So that's another great tip. So they're just things that we can do straight away. If you're having lots of caffeine, this is one of the examples that I gave in our blood pressure video on how to naturally lower it. But if you're having a lot of caffeine, I had a patient that used to drink 10 cups of caffeine a day, as in cups of coffee a day. And a cup of coffee on average has about 40 milligrams of caffeine in it. So they were going way over the recommended amount. So I recommended for them to cut down their caffeine, cut down their coffee to no more than 3 to 4 cups a day. And just by doing that, their blood pressure came down very, very significantly and nicely. So caffeine's also a big one, but we go through loads more detail in the video. So I can't recommend it enough. Definitely go and watch the video. And this live has been absolutely awesome. Thank you so much for everyone that's been involved. Thank you so much for your comments. Again, we do a live every first Thursday of the month. So definitely tune in. It's at 8 AM PST. We're going to do it every single month on the A&D Medical channel. Leave a comment on our other videos if you haven't managed to come on this live, or if you're watching this live later, leave a comment on here and we will get back to you next month. And if you're in the live right now, like we have the viewers right now, just leave a comment like you've done today, and I will try my best to get back to you all. It's been an absolute pleasure. And as we say at the end of every single week's video, A&D Medical, discover precision.